Growing up, my mom was a nurse. She's a retired nurse at this point. So I always, I just, her coming home, hearing her stories, seeing her passion for the career, there was no other option for me. It was just kind of what I was destined to do.
I had someone 30 plus years ago recognize some potential in me and nudge me in the right direction, and forever grateful for that.
I never really know why. I just always knew I was supposed to be a nurse. Something in me just kept drawing me towards it, and I've loved it ever since.
The best experience that I get is just watching that patient progress. How are you feeling today?
Doing good.
Doing good, especially after you work a few shifts in a row and you get to see that patient progress day by day.
Probably the things that would stand out the most are some of the precious moments I've had with patients when you're at the end of your rope because of anything else that may be going on, and a patient hands you a golden nugget out of the blue, whether it's something they say to you or just finally start to comply with their treatment.
I love my job because I think being a bedside nurse really keeps me humble. Hello, I'm Haley, I'm your nurse. Every morning I just wake up and I'm thankful to be healthy because a lot of these patients, no rhyme or reason why, their body just decides to do something weird and they end up in the hospital. And a lot of people don't really, I don't think, think about that every day, just how blessed we are to be healthy and able to take care of the patients.
If they need minutes of my time to express their feelings or to cry on my shoulder, I want to be there for them. Take a deep breath, let it out.
I meet a lot of patients and I'll see them out and about. I'm like, oh, you took care of me, and I'll see them in Walmart or at the store or downstairs, and just kind of always, the fact that they remember me is really nice.
The reason I've stayed here so long is the people, plain and simple. I have known several of these nurses up here for going on the whole 20 years that I've been here. We've got some great experience and knowledge up here on the floor, and working with those people, I have somebody that's watching my back.
If somebody's having a bad day, we know each other well enough where we can kind of read each other and kind of see, oh, she's having a rough day, let's kind of do something. Sometimes people even do stuff so small as like go and grab you a drink, whenever you're so busy and can't. It's nice to have people like that just kind of, you don't have to say it, they just know, because we've worked with each other for so long and I feel like we're pretty close. So yeah, it's really good teamwork there.
Love the environment, especially our unit. Our staff, they work so well together. There's always somebody I can depend on to help me get through the days. So the environment and the culture is really what keeps me around.
When I started 30 years ago, I was not just in the minority, I was in the vast minority. Whether you're a man or a woman, I mean, nursing is so versatile. So if you're a guy that likes more of a physical kind of thing, I mean, you can work in a rehab setting, you could help with orthopedic surgeries where you're muscling people around. The variety of settings is just, I don't think people realize all the job potential that's there as a registered nurse.
I love being a nurse at Deaconess. I feel like nurses have a lot of leadway. We kind of get to bring about what we feel like needs change. And we have a lot of committees where we're able to learn and teach people different things. That's all I really like being a nurse too. It's always growing. We're always learning something. You never know enough. You can always be learning. Deaconess does a lot with teaching, and if you want to grow and learn as a nurse, they're fully behind you.
At this hospital, I have worked not just on the med-surg tele unit. I spent going on 10 years down in the emergency department here too. Actually, I also had the chance to work in clinical IT to help develop some of what's going on with Epic. And in the past, going back a little further, I did a lot of psychiatric and mental health nursing. So there's, you can see in my career, I didn't land in just one little spot. I've explored a variety of my interests over time. And I don't know of a lot of jobs that give you an opportunity to do that.
Actually, moved to Evansville for Deaconess, funny enough. I think it is a great facility to work for. I love the environment, especially our unit. Our staff, they work so well together. There's always somebody that's got your back helping you. Nursing at Deaconess is amazing. It is the best that I have worked with. I appreciate every single one of my coworkers and the staff that work with me. I do see my future with Deaconess Hospital. I can't imagine where else I would be.